In our previous video on diabetes mellitus, we were able to discuss the different types of diabetes. In this video, we are going to look at the diagnosis and tests, and also the symptoms of this disease, and also how it can be managed. But before we continue, how common is this diabetes mellitus? Diabetes is actually common. Approximately 37.3 million people in the United States have diabetes, which is about 11% of the population. Type 2 diabetes is the most common form, representing 90% to 95% of all the diabetes cases. About 537 million adults across the world have diabetes. Experts predict that this number will rise to about 643 million by 2030 and 783 million by 2045. Let's look at the symptoms and causes of diabetes. Symptoms of diabetes include increased thirst, that is polydipsia and dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness or tingling in the hands or feet, swelling, healing sores or cuts, and frequent skin or vaginal yeast infections. It is important to talk to the healthcare provider if an individual or a child has these symptoms. Now let's look at the different symptoms based on the different kinds of diabetes. Firstly, the type 1 diabetes. Symptoms of type 1 diabetes can develop quickly over a few weeks or months. The individual may develop additional symptoms that are signs of severe complication called diabetes-related ketoacidosis. Diabetes-related ketoacidosis is life-threatening and requires immediate medical treatment. Diabetes-related ketoacidosis symptoms include vomiting, stomach pains, fruity-smelling breath, and labored breathing. As for type 2 diabetes and prediabetes, the individual may not have any symptoms at all, or the individual may not notice since they develop slowly. Carrying out frequent blood tests will be required before you can be able to recognize high blood sugar level. The symptom of type 2 diabetes is usually seen during blood screening, whereby there is high level of glucose in the blood. Another possible signs of prediabetes is darkened skin on certain parts of the body. This condition is known as acanthosis nigricans. In gestational diabetes, the individual will typically not notice any symptom. Healthcare provider for the particular individual will have to test for gestational diabetes between 24 and 28 weeks of pregnancy. What are the causes of diabetes? Too much glucose circulating in the bloodstream causes diabetes regardless of the type of diabetes. However, the reason why the blood glucose level are high differs depending on the type of diabetes. Causes of diabetes include insulin resistance, autoimmune disease, hormonal imbalances, pancreatic damage, and genetic mutations. The type of diabetes that arise due to insulin resistance is type 2 diabetes. Insulin resistance happens when the cells in the muscles, in the fat, and in the liver do not respond how they should respond to insulin. Several factors and conditions contribute to the varying degrees of insulin resistance, including obesity, lack of physical activity, diet, and hormonal imbalances. Genetics and also certain medication also contributes to this. The types of diabetes that arise due to autoimmune disease are type 1 diabetes and LADA. These diabetes occur when the immune system attacks the insulin-producing cell in the pancreas. As for hormonal imbalances, during pregnancy, the placenta releases hormone that causes insulin resistance. The individual may develop gestational diabetes if the pancreas cannot produce enough insulin to overcome insulin resistance. Other hormone-related conditions like acromegaly and Cushing syndrome can also cause type 2 diabetes. When there is physical damage of the pancreas from conditions like surgery or injury, this can bring about the stoppage of production of insulin, which then results to type 3C diabetes. Some certain genetic mutations can cause MODY and neonatal diabetes. Also, long-term use of certain medication can also lead to type 2 diabetes, including HIV and AIDS medication and corticosteroids. In our next video, we'll talk about the complications of diabetes and also the treatment of diabetes. See you next time.